You just realize you forgot your diabetes medication at home and it's Sunday night in Stockholm. Your hands are shaking as you Google Swedish pharmacy and everything is in Swedish. And you don't even know if they'll accept your prescription. Stop. Take a breath. I'm about to give you a number that solves everything. 1177. Save it right now. Seriously, grab the phone. They speak perfect English 24 hours a day and they will know exactly where to go to and what it will cost. I'm your pharmacist at T Pharmacy, and after helping hundreds of tourists navigating Swedish healthcare system, I know exactly what works. In the next 9 minutes, you'll learn the complete system, from the first call to walking out with your medication. And stick around, because I'll show you the 3 documents that determine whether you're gonna pay 500 or 7,000 kronor for the exact same treatment. This is 1177, Sweden's healthcare helpline. Completely free to call, we have English-speaking nurses available 24/7, and we know the entire Swedish healthcare system. We're not just giving advice, we can see which pharmacies are open, which clinics have availability, and exactly where you should go based on your specific situation. When you call 1177, they'll direct you to one of 3 places. Vård Central, that's regular healthcare center, open Monday to Friday during business hours. Nära Akut, urgent care, open 8 to 10 p.m. every single day. You can actually walk in directly without calling first, so calling 1177 is recommended to confirm it's the right place for you. Or Akuten, the emergency room, only for real emergencies. Wait times vary everywhere, you might be seen quickly or wait several hours. The sickest patients are always seen first. When you call, press 2 for English, a nurse answers, and yes, their English is excellent. Then you describe your situation, that you are a tourist and forgot your medications. We may have several questions regarding it, the symptoms, we can ask where are you staying. Then they'll direct you. There's an urgent care center 10 minutes from your hotel. They are open up till 10 p.m. Take passport and any insurance cards. With the European healthcare insurance card, it should cost around 375. No confusion, no language barrier. Just clear, direct help that gets you exactly where you need to go. And here's something important. If you don't speak Swedish or English well, you can get an interpreter for any healthcare appointment. It's completely free. Just tell them that you need one when you book. Swedish healthcare system has interpreters for most major languages. They're trained professionally and are sworn to confidentiality. Sweden has 3 pricing tiers for tourists, and knowing which one you're in saves you thousands. First tier, if you're from EU or UK and have these little cards, the European Health Insurance Card or EHIC card, you pay exactly what Swedes pay. Doctor's visit 275 kronor, urgent care 375, emergency 400. That's about the cost of a restaurant meal. And children under 18 with EHC card free at most places, just 120 at children's emergency. Second tier, Nordic neighbors. They show your ID, same low resident prices. Third tier, everyone else, including Americans. Without insurance, a doctor's visit costs 2,000 kronor. Emergency room, 5 to 7,000 kronor. That's like buying a flight back home. European healthcare insurance card proves that you're covered by your country's health system. So Sweden treats you like a resident. For EU citizens, it's completely free from your government. For UK citizens, you need a global healthcare insurance card. Same benefits. Without any coverage, you'll be paying full tourist prices. Real example, UT infection. With an European health insurance card, urgent care 375 kronor, antibiotics 200, total of 575, that's about 55 euros. Without the card, the same visit is around 2000 kroner. That's 4 times the price for the exact same care. Swedish pharmacies are everywhere. Just look for the Green Cross or the sign Apotek. Most of them work till 6 or 7 p.m. In bigger cities, you can find pharmacies that have longer work hours. A quick tip: both clinics and pharmacies prefer card payments over cash. Now let's talk about prescriptions. This is where it gets confusing. Quite often at my pharmacy, a Norwegian or Finnish tourist comes in, shows me their phone, and says, "Here's my electronic prescription." We can't understand that their prescription does not work here in Sweden. We assume because we are neighbors, we must be connected, but we're not. Sweden, Norway, Denmark, or Finland all have separate electronic prescription systems. Nordic citizens need to get a paper prescription from home, or better yet, get a new Swedish prescription. The reality is EU paper prescriptions are legally valid, but pharmacies can deny them if there's insufficient information or if they can't verify their prescription properly. Electronic prescriptions from anywhere don't work at all, and prescriptions from outside the EU definitely won't work. My advice: get a Swedish prescription. It works everywhere, no questions asked. Before you travel, take photos of all your medications, the bottle, the label, everything. Show these to the Swedish doctor, they'll write you the Swedish equivalent in minutes. Critical detail most tourists miss. When a Swedish doctor writes you an electronic prescription, they send it to one specific pharmacy location. Before you leave a doctor, make sure you know exactly which pharmacy to go to. Ask them to write down the address or text it to you. Good news: prescriptions are ready immediately if medication is in stock. EU prescriptions should work, but in reality you might face some resistance at the pharmacy. My advice: just get a Swedish prescription. It works everywhere, no questions asked. Before you travel, take pictures of all your medications. The bottle, the label, everything. Show these to the Swedish doctor, and they'll write you a Swedish equivalent in minutes. Good news at the pharmacy: Swedish law requires pharmacists to automatically offer the cheapest available equivalent at the time. But it doesn't hurt to double check by asking, is this periodens vara? Which means the cheapest available option, which changes monthly. Screenshot this survival card right now. 5 essential points: 112 for emergencies, 1177 for everything else. Bring your passport and insurance cards. Get a Swedish prescription, it's always easier. And always get the specific pharmacy address in writing. The two scenarios cover most tourists' medical needs. Acute infection like QT or strep throat. Call 1177, will get you to urgent care same day, antibiotics within hours. Lost your chronic medication? Photos of your meds in the health center, new prescription same day. The system works. These are the situations I see almost every day at the pharmacy. Sweden's healthcare system will take care of you. The staff speak English. The quality is excellent. Without insurance, yes, it can be pricey, but you will get help, that's guaranteed. If this helped you feel more confident about traveling to Sweden, hit that like button. It helps other travelers to find this information. You've got everything you need now to handle medical care in Sweden as a tourist. And speaking of Swedish pharmacies, I still remember the first time a customer asked me for their cat's thyroid pills. I was confused. This is a regular pharmacy, not a veterinary clinic. But in Sweden, that's exactly where you get pet prescriptions. I'm talking about completely integrated system where your pet's prescriptions go through exact same pharmacies, same electronic system, and even tied with your social number. No stalking issues at the vet clinic. It's revolutionary. Until then, stay healthy, travel smart, and remember, 1177 is your helpline. I'm your pharmacist at T Pharmacy. Hej då!